And they are physical therapists with balance therapy, and they're trained in, and they'll tell you so much more than me, in a treatment that is geared towards Parkinson's, but from what I'm understanding is helping other diagnoses too, and with a lot of success. So I wanted them to come in to share their expertise today, and I appreciate it very much that you're here, and I look forward to learning today.
Yes, thank you for having us.
Yeah, thank you so much, Eileen. So Abigail is trained in Lsvt, which is the program and therapy that we're going to be discussing further. And I'm in training, so she's going to take the Lsvt portion of the presentation, and I'll discuss the beginning part. So the agenda tonight is that we're just going to go a little bit into the condition of Parkinson's, progression, and the motor changes. And we know that you guys have discussed this in the past, but if you guys want to delve into anything deeper, let us know. We're going to go into Parkinson's and exercise as that relates into the literature. What does the literature say about it? Abigail's going to take over and describe what Lsvt is, the benefits, what that program entails, and then as it relates to the research again. And then we're going to kind of conclude with some sample exercises seated in our chairs that are Lsvt exercises. And then we'll open the floor to you guys for questions. All right, so the more you know, right? Parkinson's is a neurodegenerative condition. It's right behind Alzheimer's in its commonality. And it's described, or it's characterized by a loss of neurons in a particular part of the brain called the substantia nigra. And the substantia nigra puts out a chemical messenger called dopamine. And it's this loss of dopamine that is seen that initiates smooth motor output, or our smooth motor pursuit. If I, excuse me, I have allergies, I apologize. So most cases of Parkinson's are idiopathic, meaning there's no real trigger for them. There's no known cause. However, we have secondary and also atypical Parkinson's, which is what we were just discussing, in that we can have, it's not, the loss of the substantia nigra neurons is not the primary initiator for those motor changes that we see. So the Yohan-Yar scale, correct me if I got my pronunciation wrong, is a very common scale used to categorize the disease progression. It was made by two people back in the 60s, and it's one of the most common scales, as I said, used. So stage 1 is unilateral involvement, and I'm just doing a brief one for each stages, brief description. Stage 2 is now bilateral involvement. Stage 3, now we start to see some postural and balance deficits. As we can see from this image here, a little bit more trunk leaning, a little bit more of a crouched gait. Now stage 4 is a progression of stage 3. It's more of the moderate stage of the disease, but they are a little bit more reliant on an aid or an assisted device, but they're still categorized as independent with your mobility. Whereas stage 5, now you're no longer independent or pretty much specifically or all the way reliant on an assisted device. So I just wanted to briefly, this is kind of a lot of words, but I think you had mentioned before, Eileen, or maybe, and I think you had just mentioned it, that 60 to 80% of the dopamine decrease is observed before any motor changes. So meaning that before we see any motor changes in the clinic, before that is noticed, we can have 60 to 80% of a decrease in our dopamine. So being preventative, taking preventative action is key in this case, and all cases, I should say. All right, so what is a medical doctor looking for? What are we looking for? So early motor symptoms, which we will kind of go on about. So I'll just briefly describe resting tremor that can be seen in the jaw, the foot, or the hand. Rigidity, so that's increased stiffness of our muscles. Postural instability, as we noted before in the image, that's that forward bent posture or crouched gait. And then brady or hypokinesia, which is that difficulty with smooth motor patterns. As well as we said, there's no real there's no real trigger for this condition, as well as asymmetrical distribution, meaning it can affect the right arm and the left leg, and then a positive response to a dopamine replacement medication, and then an exclusion of any other diagnosis. So let's talk about some exercise. All right, so there's a variety of exercises that Parkinson's benefits from. In this study in particular, they were looking at three specific exercises don't always have carryover effect, meaning that if we're working specifically on balance, if we want to train balance, then there are some exercises that are better than others to see those effects for longer. So in this particular paper, they found that Tai Chi, dancing, and strength training had a carryover effect of 6, 12, and 24 months, meaning that when they reassessed these people, that they still had those skills and that they were still seeing benefits from these activities way down the track. Did I skip ahead? No. Okay. All right, so this one that I wanted to point out, so the 2020 relatively recent study, and this was done a systematic review and meta-analysis, meaning that for their topic, they collated all the papers in their topic, and they were looking at what is the conclusion of all these papers, what do they say? So they found that for individualized exercise, that it was statistically significant to improve. UPDRS is the Unified Parkinson's Disease Rated Scale, I think. And anyway, so that's the disease progression. So it was shown to slow disease progression, it improved balance, it improved walking, and then it improved our timed up and go, which is essentially our assessment for falls risk. So I think if Abigail, we were discussing this before, she was saying that there was it wasn't a causation, but it was a really nice correlation for this paper found. Now, this is a really nice segue into Lsvt. This paper was done in 1994, so a little ways back, but the fact that this has been known and studied for that period, this length of time, is a really good sign. So what they had looked at, what this graph is telling us, is that they were looking at walking, the amplitude or the speed, and the stride length, and their postural stability, and that how that affected with, it's a little hard to see, but with cues of verbal cues of saying like walk faster, and then visual cues of targets on the floor. And they were saying, can we improve with just these two criteria? And they found that they did improve over, I believe it was a period of 2 weeks. They saw this marked improvement, and this was an hour of every day of this treatment. So another important note for this study was that they found that we can kind of bypass the substantia nigra, which is something that is hindered in Parkinson's, and we can retrain the frontal cortex to take on these smooth motor motions or movements. And so that's really important when we start to discuss of neuroplasticity and the benefits of exercise.
Okay, so what is Lsvt big? Lsvt is Lee Silverman voice treatment. So there's an organization called Lsvt Global, and it was founded by Lee Silverman. So it originally actually started as Lsvt Loud, which is for the voice treatment portion of Parkinson's. As you probably know, or if you don't, Parkinson's not only affects motor movement, but it can also affect the voice and the motor components of voice, which I know Eileen is definitely helping with that portion as well. So they developed Lsvt Big. So really what this program is, it's a standardized therapy protocol. And the treatment looks something like 4 days a week, 1 hour sessions, 4 days in a row, and you do that over the course of 4 weeks or a month. So it has to be consistent, it has to be dosed like that in order to see effects or large effects from pre and post treatment. These components, as Eileen had mentioned earlier, can be used in a variety of neurological diagnoses, not just Parkinson's disease, especially since Parkinson's disease is a diagnosis of exclusion. So sometimes it takes a long time to finally get a diagnosis. These components can still be used across all types of neurological diagnoses. There's some outcomes that You can see there's an image in the handout that we gave you. But they really work on increasing amplitude of movement, so large scale movement, improving your dexterity, grip strength, increasing speed of movement. So I know that Christina mentioned the bradykinesia or hypokinesia, so slower movements can help improve gait speed. And also it can not only with, at the top box there, improve your functional outcome measures, scores like timed up and go, and the other scales that she was mentioning, but it can also improve like quality of life. Being able to do functional tasks more independently and things like that. Keep going. Okay, so what does the literature say? So in this case study, there was an individual that before being involved with Lsvt big program that was diagnosed with Parkinson's had about 1 to 2 falls per month, which is not great. You don't want to be falling at all. And once you've had a fall, your chance of falling again goes up. So they were using a cane also as well. Their gait velocity was very slow, and their endurance wasn't very fast. They probably did like a 2-minute or a 6-minute walk test just to see how far you can go in that amount of time. So walking endurance was very poor. They went through this program, Lsvt Big, to improve walking. The patient had a goal of being able to go to the movies, playing with his grandchildren, and like being able to go out to dinner with friends and family. This was very hard. So not even, just the Parkinson's disease affecting movement, it also affects your life. A lot of people don't really want to go out anymore because they've changed so much physically that they have a hard time going out and doing activities with family, friends, and so forth. After they went through the 4 times a week for 4 weeks, they did a post-test of all these outcomes. So self-reported falls, no falls after they've did this program per month. He went from having 1 to 2 to none, which is fantastic. Went from using a cane to using no assistive device. Increased his walking speed by a lot, actually, 1.17 meters per second, and had a huge increase in his walking distance and endurance, going from 730 feet to 1,200 feet. So as you can see from this, he increases probably functional independence and also balance and walking endurance, which is great. There we go. So this is another randomized controlled trial looking at doing the Lsvt Big protocol versus a short training protocol. And I think the shortened protocol was 5 one-hour sessions per week for 2 weeks. So about 1 more day a week, but it was for half the time. And it shows that overall how much change did the patients report or clinically do we see in the same amount of time. And you can see that Lsvt Big here is the dark bar. A lot of people, like very much or much improved going through the protocol here for Lsvt Big versus no change in movement was seen or minimally improved for just doing the 5 times a week for an hour for 2 weeks. So here, this is a writing sample. A lot of the times you can see with Parkinson's, it affects the way that an individual perceives not only themselves, but their own movement. And I didn't really know this because I don't have Parkinson's, and it's really hard for me to understand what patients are going through. So after taking this course and becoming certified and seeing things like this, it was very clear to me that individuals with Parkinson's, they think that they're moving normal, and they think that they're doing things normally. But as you can see, this writing is very small, and it's not what is deemed as normal to the rest of us. So you can see they usually do writing tests just to kind of see like the writing's really small, it's really more illegible, not a lot of amplitude. And so this was before going through Lsvt Big, and then they did a post-writing test, same material, and you can see that this is now much easier to read, much more legible, and even the letters are even, like the writing quality is even bigger and clearer. So even though like gait speed, things like not wanting to fall, those things are very important. It can even have an impact on writing, even like buttoning your jacket, things like that. Okay, so we just have 2 exercises here that we were gonna take you guys through, just kind of as a sample of what Lsvt Big exercises incorporate. There are, I believe, 7 exercises in the program that you would go through, and they go in a specific order and sequence, and these are the exercises that you would do every single day. It takes probably about an hour to do them. They're the ones you do every day for 4 days, a week, for a month. And so obviously before you would do the program, we would take a lot of pre-test measures and then have you go through the program and do a lot of post-test and see if there's any self-reported improvements as well as the objective reported improvements. So the first one is really the first one that you do in the series. So let me just move this chair here.
Might also spread out so you can do it.
Yeah, if you guys would like to do it with us, only if you feel comfortable. So a lot of the exercises, as you can see, is they're sustained for a certain period of time, which is normally 10 seconds. You want to make sure that you have a big posture and you're moving big and through all the segments of movement, and that they're clean, crisp movements. So a lot of the times what physical therapists will do that are trained in Lsvt big, we're cueing you constantly through the movements to make sure that you're doing big movements, you're counting out loud with us, because that is also a huge component, and that we're making sure that you're having all these big postures and reinforcing. So the first one is, you can sit probably a little bit closer towards the edge of the chair. And I always start people having their hands on their laps. So the first movement that we'll do is you'll go out big. Good. So out big. Good. Next one is down big. Good. And then up. Reach up big to the sky. Good. And then out big to the side. And let's count for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then big finish. Yes, big finish. And I don't want you slapping too hard, but a big finish. So let's go through it. We'll do it 3 more times, okay? So, out big, down big, up big, and out big. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Big finish. Try to think about moving as big as you can. You might feel like it's a little bit ridiculous. You might feel like you're moving like crazy. But to us, that's what is normal movement. So that's what we're trying to reproduce with these exercises. Okay, 2 more times. Out big, down big, good. Up big, and out big. Big posture, ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Big finish. Okay, 1 more time. Ready? Out big, down big, up big, out big for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Big finish. Okay, good. So that's like a sample of one of the first, actually the very first exercise that we would take you through as part of the Lsvt big program. It's a combination of sitting and standing exercises. Today we just did sitting for sake of space and safety, since we have not done a safety assessment on all of you. But the goal is that there's a lot of things that work on sitting balance, posture, moving outside of your base of support. And then with more of the standing ones, they focus a lot on walking mechanics, gait mechanics, which is really good because walking is a huge thing that is affected with Parkinson's. So for the one that we would do side to side, usually you would do, you would do it to both sides. For this sake, we'll just do it, let's see, all of you. It might be easier just to go towards my right. I think that would be their right? Yeah. Their left.
Mm-hmm. Yep, their
yeah,
left.
okay.
Mm-hmm.
It's the end of the day. Okay, so for this one, you do want to be on more the edge of the chair, but when she's swinging, she steps out towards the side big, comes through with the arm, and my other hand's holding on to the chair. If this is really hard, you can just think about shifting your hips back further in the chair and reaching up to the side. There you go. Good. You can scoot it forward a little bit further. You guys all look good. Just a little bit more. There you go. Good. So this one is like a swivel of the hips. coming up and through.
Yep, I got it.
Okay, so let's just do 3. Same thing, we're gonna hold this position for 10. So you wanna have big posture to start. And let's go ahead and swing and open up and hold for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Big finish. Good. Okay, we'll do 2 more times. Ready? So swing through. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Big finish. Good.
Nice.
1 more time. Okay, ready? Swing through. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Big finish. Good. Okay. How did that feel to everyone? It's all new, but that's a little sample of kind of what Lsvt big movements are. And you would do those movements over the course of 4 weeks. So let me just see. So final tips and takeaways. Practice makes perfect. So initially, a lot of these exercises are something new. When something's new to a lot of us, we're not going to be masters at it. When I did this certification course, I was definitely not a master at it. We actually did it online, so it was really hard for me to learn online and seeing a screen. It takes a lot of cueing and a lot of practice. So even after I took the course, still was not an expert. I've had to practice this a lot. But that's something that I or Christina could work with you on, is making sure that your form is right, and we would break down the movements until you would get it right. And at first it would be a little bit more difficult, but then you're gonna get used to it and it's gonna feel a little bit more normal. So practice makes perfect. It doesn't mean, when you're diagnosed with Parkinson's disease, I know that diagnosis can seem scary and it can seem like it's an end-all be-all. But it doesn't mean that your life has to stop there. You can be so much more than just having Parkinson's disease. There's many different tools, as Christina and I have talked about, not only Lsvt big, but even different movement therapies. You know, Tai Chi, there's a boxing class for, I think, Parkinson's here in Monterey, if I'm not mistaken. Honestly, any movement and exercise that you can be doing in addition to maybe this, or just in general, including medications, can help delay the symptoms of Parkinson's disease. It's not a cure. They don't have a cure yet, but this is something that can slow the progression. And that's really what you're looking for, is you want to slow the progression of the disease for as long as possible. Not all exercises for everyone. So if this is something that you're like, I'm not too sure about, there's tons of different researched exercises, which is why we mention them, to see what maybe fits your needs and fits your comfort levels, or even piques your own interest, especially since a lot of the Lsvt movements are a little bit obscure. But just honestly, as long as you're keeping your amplitude of your movement big, if that's all you take away from today is just move big, bigger than you think that you're gonna need to move, that will help you and take you far. It's important that if you're considering any type of exercise, whether that be Lsvt big or that is, boxing, Tai Chi, whatever it may be, make sure you consult with a doctor or healthcare provider just to make sure it's safe for you to be doing. We don't want you to be doing anything that's unsafe. And just make sure that it's appropriate for you and your stage of Parkinson's, as everyone is at different stages and different diagnosing levels.
One of the things I did want to point out or highlight that Abigail said was the Lsvt program is one of the principles is salience, so meaning that it has to matter to you. Mm-hmm. So no treatment is cookie cutter. It is things that you want to work on that are pertinent to your lifestyle.
Yeah, and even in the course, after you take the course, they even, like I said, they took a patient that had issues buttoning their jacket. That's all they wanted to be able to do was button their jacket on their own. Had a very hard time with that. They went through the course, and even we can do specific training for those tasks. So think about moving big, like pushing the button through the hole big, instead of, very small movements. It could be something as simple as that, but these principles can still be applied to things that you would want to do in real life. So movement is medicine. That's probably the number one thing that PTs preach, is that movement is medicine, because it truly is. Movement, as we've kind of talked about today, can help slow the progression of the disease. So in addition to, obviously a medication regimen that most patients are put on with Parkinson's disease, we highly recommend also doing some kind of movement. They drive neuroplasticity, which is, the creation of new pathways in the brain to help stimulate more movement. And only just like motor learning, which is anything that everyone could do. Motor learning doesn't stop when you're, 25 and they tell you, then you go downhill from 25. Motor learning and learning new things and creating new pathways in the brain can happen at any age, just as long as you keep challenging yourself and trying and learning new things. And that includes movement. So the minute we stop moving, I tell people, is the minute that we kind of get ourselves into some issues. And so just always keep moving and trying to do new things that challenge us, can create new motor pathways, which is very important, not only for movement disorders, but also just for mental health as well. And exercise can improve the brain functioning and, like we said, can slow the progression of Parkinson's disease. All right, thank you. Any questions?
Yes. Could you explain some more about this? The difference between hypokinesia and bradykinesia?
Yes. Yeah, so bradykinesia is slowed movement. So bradykinesia is slowing of movement. Yep, so the movement, like if you were to see walking, instead of speed walking or being a normal pace, you just slow down the pace at which you're moving. Even if that's reaching for a cabinet, it could still be just slowed down movement. And then hypo is below or sub movement.
No movement.
Not exactly no movement, just decreased movement. Yeah.
Would that be like when we see the shuffle, the short little steps?
Yep. So like instead of having a nice long stride, hypokinesia could be like, you still have a stride. It's just very little now. So it's decreased. Versus bradykinesia is more about like speed of movement, because there's, I don't know if I've ever heard of tachykinesia or whatever the fast, but usually you can hear a lot of like bradycardic or tachycardic, meaning slow heart rate or fast heart rate. Those are medical terms, but
Bradycardia.
yeah. So that in that example, slow heart rate. So bradykinesia, kinesia meaning movement, and then brady meaning slow. Yeah.
That's a good question.
Oh, another one. Salience, I don't know if I'm pronouncing it right.
Oh yeah.
What does that mean?
So salience, as was used in the Lsvt training course, they mean that it's pertinent to the individual, meaning everything is individualized to you or to me. So that's what salience means, is that, if I understand that correctly, is that it is pertinent to you, and therefore we are more likely to remember or be motivated to do things that are pertinent to you versus, if you asked me to go and, learn how to drive stick, I would not be very interested. So
it's specific to who you are. Mm-hmm. Yeah.
So I see it as something that's meaningful.
Yeah.
Something that's meaning to you, something that you see worth in. That's the big one. So someone who sees worth in this is more apt to really put their all into it.
That's a good way of putting it, yeah.
If we go back to this slide specifically, in this case study, this is what was important to this patient. They wanted to be able to go to the movies by themselves, or they wanted to be able just to go out and see a movie. They wanted to play with their grandchildren. So these are things that Parkinson's had kind of taken away from him, or he didn't feel like he was able to do because of the disease, of the functional movements that he probably can't do anymore. Going out to dinner. I think I remember this slide in the presentation when I was going through the course, is that this patient, since being diagnosed and having such increased symptoms from who he was, he didn't want to be seen out in public, because he was just embarrassed of how he wasn't himself anymore. He didn't feel like he was himself. So these were stuff that he wanted to do that was important to him and meaningful to him, that he wanted to be able to do again. So when he went through this, he was able to achieve a lot of more confidence, I would say, even too, going through this program, so that he was able to go and do all these things. And that was important to him.
That's a good question.
tremors.
What's that all about? Is that something you can control? That's something voluntary?
So I have a little bit on that. I don't know if I understand like the whole pathology of that, as I don't know if they understand completely the whole pathology of Parkinson's. But one of the things, so dopamine is our smooth motor pursuit. It also affects norepinephrine, and that's more of our automatic system, if that makes sense, if I have that word correctly. So things that we might normally be able to suppress, we wouldn't have to think about. That becomes there's more excitation or more excitatory movements. So that is how I understand that the tremors come about. But tremors are not present that they know of or that they have observed during sleep. It is during waking conscious hours. But at least I don't have a good reason why they would kind of present in the hands, the feet, and the jaw versus other places. That's a good question. Do you have Dad?
I know that there's different types of tremors as well. There's a resting tremor, which I think is most commonly seen in Parkinson's disease, where you're at rest, you're not doing anything, and you get these tremors. You get this abnormal movement that you didn't have before. There's also other types of tremors that like intention tremors, where if you were to go grab a pen, for an example, you don't have a tremor at rest, but when you go to grab a pen or focus in on a movement, that's when you would get the tremor. And they all affect different parts of the brain and different motor pathways, but most commonly is usually seen in a resting tremor in Parkinson's. As I remember from schooling was that, kind of like there's no like on-off kind of mechanism, where at rest, without any, depletion of dopamine, our brain is able to say, we don't need this excess movement. But when there's a depletion of dopamine, there's no like on-off switch. The brain has a hard time determining when to move and when not to move, which is sometimes when you would see the freezing patterns that some people commonly also get in Parkinson's. Freezing or the festening, where you're having a hard time getting through a movement pattern. The brain has trouble initiating those on-off movement patterns. I don't know if that helps or answers.
All right, that's great. Mm-hmm. Does that answer your question, kind of? Or?
Yeah, it does. I've had Parkinson's for a few years, as far as I know, and that was the most noticeable thing.
Yeah.
Was the shaking of my hand and my foot. And I always kind of felt like, can I just say no to it? Or can I exercise it away? It doesn't seem to work. Well, maybe the exercise is what I do a lot of.
Yeah.
This helped me.
Good.
What exercise do you do, if I don't mind asking?
What
exercise do you do, if you don't mind me asking?
Treadmill,
Okay.
and I do walks.
Mm-hmm.
And so, and I try to keep it maybe a couple mile walk or some 2 or 3 mile walk on the weekend. And the treadmill, I try to do about 40 minutes a day.
Okay, very nice.
I'm trying to, I hear the unanimous information is that exercise is like the best helper.
Mm-hmm.
That's what I'm gleaning.
Mm-hmm. Yeah.
They've also done a lot of research on like rhythmic exercise, so like treadmill walking, bike riding, for individuals that have Parkinson's disease. I think a lot of the times why boxing got really popular is because there's a lot of rhythm in that. It's kind of they have like a kind of a metronome pattern where you can kind of, or even dancing where there's kind of a beat you have to stick to. A lot of the rhythmic training can help also to kind of override a lot of the symptoms of Parkinson's, because you're kind of given a pattern to follow, which I think Christina had mentioned earlier too, with like walking and things like that.
Yeah. I think one of the studies that we had mentioned, it's not exactly what you said, but I was just thinking of it, that they showed that with practice and focused effort, we can kind of retrain some create new pathways towards better motion, if that makes sense. So it doesn't. I don't think that they studied tremors in particular. They were looking at hypokinesia for walking, but the fact that that is there, I mean, that showed positive results, I think. I think that's pretty phenomenal, actually. That's pretty exciting.
Question for you, quick.
Yeah.
Prescription needed to come to PT?
Yes, if you would like to have it covered by insurance, yeah, it would need to come from, most likely, probably your neurologist would probably be the best, because they're probably more familiar with your case sometimes than, primary care.
Exercise in
Yeah,
general.
a lot of,
And then she said a stationary bike
yeah.
she has, but it's
Yeah.
not a problem to call her up and have her.
Yeah, a lot of the referrals, I have a couple of patients that have Parkinson's on my caseload right now, and a lot of the referrals came from their neurologist.
We do
Yeah.
a lot of exercise in the garden.
Well, that's good.
Weed eaters.
Weed eaters. That's good. But yeah, usually if you would like to have it covered by insurance, yeah, I would get a referral from your doctor and then we'll get you scheduled. Now I know that in Balance Physical Therapy, we haven't really found a way to strictly follow this prescription. The patients that I do have, we work on a combination of things, and most of the time I will show a few exercises or use some of these exercises within a session, but it's not the complete regimen. So that's something that we will still probably problem solve and try to figure out if that's something that we can attain. But if not, at least showing some of these movements, giving handouts to our patients that have all these exercises. Even if that, I've done it with a patient where I didn't have a full hour to do the exercises with, but I have done like half the exercises one session and half the next session, and then kind of let them go home, practice it, and then we'll review it kind of in a few weeks just to see how things are going. Especially it's always helpful because you may think that I'm doing this, I feel like I'm moving correctly, but it's nice to have the therapist there to really cue you and push you to move big and have these big amplitudes and moving larger and more normal. That's why I said it might feel a little goofy or silly when you're thinking, oh, I feel like I'm moving goofy. But that's what we are trying to get you to move like.
Yes. This type of therapy, is it used in conjunction with conventional drugs for
Parkinson's? Yeah. Like the carbidopa, levodopa regimen most people are commonly put on. Yes, we actually would recommend that if your symptoms are progressed enough or that you feel like your movement is better and with being on the medication, we actually recommend trying to exercise during your on time, meaning the medication has taken effect and now you're moving a lot better, versus your off time is when you're not on the medication and movements are really hard. You have a lot of the rigidity like Christina talked about. Maybe you have a lot more tremoring or the freezing of gait. So ideally you would want to take the medication, maybe, take the medication, let it get into the system, and then come and do therapy so we can maximize the amount of movement that you can get in that session. Usually it's commonly hand in hand, therapy and medication, yeah.
Oh, another question. Medical marijuana has been in use in the treatment of ailments. Has this been tried in conjunction with the?
That's a good question. I personally have not looked into that, but
I haven't either. I had a professor in my undergraduate program that just started to go over the effects of medical marijuana with exercise prescription. It's very new because this drug is not regulated federally. So a lot of the testing actually and trials for those kinds of things happen in Colorado. Were happening in Colorado at the time, and this was, 4 years ago, I think that I was an undergrad. So it's been a while, 4 or 5 years ago. I'm not too sure on the current research. At least when I took this course 2 years ago, they did not discuss anything in conjunction with. There's just not a lot of research right now just because of the laws of the government and government regulation. But there's more and more happening every year. So that's a good question. We would have to probably look at the current research and figure out if there's anything in conjunction, at least with Parkinson's disease.
Yeah, that is a good question.
Are you allowed, just in case there will be some experiment on that one, are you a doctor of physical therapy, so will you be allowed to prescribe medical marijuana?
No, doctors, as physical therapists,
Not yet.
we do not prescribe medication in
No,
general.
not at all, yeah.
So I would recommend asking your doctor. Maybe they have more information as well. But we're not allowed to prescribe or make recommendations for medication.
Right.
Other than like I said, I've noticed the increased effects of taking medication for Parkinson's with exercise.
I don't know if I'm asking too many questions.
No, it's okay.
You're
Some
fine.
of them might want to go home. But if you, may I ask?
I think
Can
it's
I
great.
ask?
Yeah.
Mm-hmm.
There was a result of test there wherein the before and after
Oh,
was
yeah.
compared.
Pre-
This one?
I think the pre
somebody
and
who
post.
can walk, so
I think
no,
the
no,
pre
no.
and post.
This one?
That one. That endurance test.
Oh, yes, right here.
Is that a result of the group test or just individual?
Individual. So I'm not exactly sure what exact test they did. There's a couple of tests that are common amongst physical therapists that we prescribe. Like I said, it could have been a 2-minute walk test. It could have been a 6-minute walk test, where you're just walking for a certain amount of time, and the therapist goes around and measures the distance that you walk in that time. In this test, you're allowed to take as many breaks as you want, but the timer doesn't stop. So I'm not sure which one they use. I'm thinking maybe 6-minute walk test, looking at the patient's goals, being able to go to the movies or go to dinner, where it would require longer distances walking. That's my guess. And since he just wanted to improve his walking in general, they probably did the longer endurance test. But that's a big difference right there. That's almost like, 500 feet difference. So, pre-test is you're walking, taking as many breaks as you need. We're tracking in with our little measuring device to see how many feet you walk. And then, you'd go through this program and we do the same exact test. Same testing scenario, everything like that. Same instructions, keeping everything standardized. So, yeah.
Yeah, and as Abigail said, and as you might already remember, it's a month time period between this pre and this post, and that's actually pretty good. Pretty big difference for a month difference.
And a big thing too that I know that we didn't really mention, but gait speed has a high correlation with mortality. So meaning the slower that you walk, the higher your mortality rate. So the chance of you not being, experiencing a death event, because they also correlate gait velocity or gait speed with also how many times you're going to fall, which increases your risk of falling, maybe hurting yourself, and you end up in the hospital, which is the last thing we would want to see for anyone. So as we age, it's especially important to make sure that our walking speed does not decline and it stays within the age norms, the age normative values. And there's different cutoffs for everyone that's in their ages. And they even compare, there's a good resource that at least I use called the Shirley Ryan Mobility Lab. And they look at a lot of even specified groups. So individuals that have Parkinson's disease and have been diagnosed with Parkinson's disease, and they look at different age norms in that group. So it's not like you're being compared to people who do not have Parkinson's disease. So I use that a lot of the time to look at what is a normative value for this person in this age group that has this diagnosis, so that you're not being compared to someone who doesn't have this. You're not battling a disease that makes it difficult to move. So, if that helps. But yeah, so it's very good questions.
You mentioned about 7 exercises that you were supposed to. Since we don't have the time, where can I find these exercises? Or any book that may have?
So Lsvt is a program, so they kind of hold tight onto their exercises. So I don't think, unless you maybe, went to the dark web, that they would have that they would have it out there, because that's their product, right? Are these established successful exercises. Now, I think that there might be samples, but as Abigail was saying, it's very helpful to have someone cueing you for exactly the right movement because, as some of the studies were saying too, it's the verbal and visual cueing that produces some of the best results. So short answer, I'm not sure where you'd be able to find all 7 since they kind of, it comes as a product kind of thing.
You can always go to a physical therapist that is LSVT certified. You can even, I don't know, where did I have the link? You could even go to their website. So or if you just type in LSVT Global, you can, I believe, you can go there and you can find a provider near you. I actually need to get my name on the list as a provider. I have not done that yet, but you can see if there's any providers near you that have it. I did have my card in the back if you're interested in going through this program. I can, if you come to therapy and I think that this is appropriate for you, given your specific case, this is something we can definitely work on. And if I feel like you're confident enough to do it at home, that's something I also give patients the opportunity to do.
So my question is, are the exercises standard for
For everyone?
regardless of age group?
Yep, they're the same set of 7 exercises across anyone who completes this. Yep, I think they do have some modifications.
Yes.
For different levels and severities of Parkinson's disease, but they're the same movement for the most part, yeah.
I checked with the senior citizen, and the only thing that they got going, the only thing they got going now is that sitting in the chair.
Oh, a lot of chair stuff.
Of all the things that they do, that's the only thing you would be come close to this.
Can find, yeah.
All they have is
Chair
yoga.
stuff, chair yoga. Okay, yeah. And a lot of the times, that's why it would be important to come to physical therapy, because we would also assess your balance. We're not just going to take you through stuff and let you be rogue. We would assess your balance, and that's why it's helpful to have a therapist there, because we would use a gait belt, make sure you're very safe. We would have someone maybe modeling the exercises. Like in our clinic, we have 8 physical therapy aides, and we could have them model the exercises while we're making sure that you're secure and safe. Because obviously everyone wants to be able to be as independent as they can be, with walking, with movement. So that's a way that we could still be safe, but getting you to use doing some more of the advanced exercises where you're on your feet or it challenges your balance a little bit more. Because there are some that do, I will admit, they do challenge your balance, which is good.
See, my concern is, okay, it's like,
I've got 5 fruit trees, about 15 blackberry vines, and 22 green beans planted.
so he's gardening, but. and
My
like your-
backyard is over 100 foot deep,
Oh, okay.
so I got all kinds of trees back there.
Because he goes out by himself. But my other thing is, he's gonna be 89 this year.
Wow.
Congratulations.
So, age factors into this.
Yeah.
I haven't filmed yet.
Yeah, he hasn't
I
fallen.
just want my equilibrium is the only thing I worry
And,
about.
he has
Yeah.
his trouble with his equilibrium every once in a while.
Yeah.
I carry the cane, so they kind of help balance.
But we will be in contact.
Okay. Sounds good. I look forward to it. So, does anyone online have any questions?
Maybe check. I actually have a question.
Yeah.
I know my field with swallowing and speech, early intervention, we're finding studies now are saying is really important for longer lasting. Are you finding that with this too, that the earlier the better, or?
Yeah.
Yeah.
Yeah, I've had someone that was diagnosed with Parkinson's almost 10 years ago. Didn't have any idea what Lsvt big was, and I think that if earlier on was implemented, I think that there would be a lot more functional mobility than there is right now, because now it's very hard to do these exercises with them, no matter the modifications. So I think that the earlier the better with anything. Movement, even if, like I said, even if it's not this, just any kind of movement that you find that's enjoyable for you. Maybe if it has like a rhythmic component, like cycling or walking, I think would be very beneficial earlier on. Like I said, this is slowing the progression. So if you can catch it when you're maybe diagnosed early or even middle stages, will prevent further decline. So that's what we're really trying to look is preventing further decline.
Hi, Marlies and Deidre, can you hear me? Hi, do you ladies have any questions? sure. Also, you said it's works for other diagnoses. Like, which others have you noticed that this is beneficial? Parkinson's, of course, we've been discussing.
Go back.
Did you have a?
We have all the way at the beginning, sorry.
No,
Is it
to-
on there? I mean,
So roughly, it's a lot of different things, but a lot of these conditions
Yeah. Probably more.
present similarly too.
On this side.
oh, Lewy body
Dementia
dementia.
too.
Okay.
Honestly, I think what I remember from the course, individuals that have had a stroke, even individuals that have had some spinal cord injuries, anything that has dealt with functioning and processing of the brain that has now affected movement can help. And like I said, if there's anything you're going to take away from this, is just keep moving, and if you're going to do it, move big. A lot of the times, when something has affected the brain, it changes our perception of movement. Example, like even though a stroke is very different from Parkinson's disease, affects different parts of the brain, a stroke sometimes people have where they have neglect. They don't realize that there's another side of their body. So that changes the way you perceive movement. It wouldn't be like someone that has a different diagnosis, neurological diagnosis, probably wouldn't be as appropriate for the 4 times a week for 4 weeks. But you can, as therapists, we can use these components of this treatment to help increase amplitude of movement and balance, gait, things like that.
I noticed I use it with other other diagnoses because of the automatic pathway and the non-automatic that you were talking about. So bringing our attention to what we're doing in the moment makes a big difference.
Yes.
That's a good point.
Yeah.
Any other questions?
This was excellent. Thank you so much.
Yeah.
Really appreciate your guys' time, by the way. Thank you for you guys.
So next month we have a speaker. They're usually here, but she had an injury. They went on this big cruise to Egypt, and when they got off the cruise, something happened. I haven't had a chance to talk to her, but she's been injured. But her husband has Parkinson's, and she's going to be coming in and speaking as a caregiver, as a loved one, about the type of support maybe the person needs, what's appropriate, and the support that the caregiver needs too. So I think that's going to be a really good session. That's next month. We are taking June, July, and August off. People tend to be gone anyway. Starting up again September. The speakers I have lined up already. I have a dietitian, which is really important because the digestive system changes with Parkinson's as well. This is a really big deal to make sure that we are working from beginning to the end. And so she's going to be coming in with that targeted nutrition for someone with Parkinson's. I also have a talk therapist. She's not a psychologist, but she has another title coming in because another issue with a lot of people with Parkinson's is depression. And just all the feelings that come with Parkinson's and not being able to do what you could do before. Even though with Lsvt and some other treatments for swallowing, talking, other things you can do a lot. But there's a lot of emotions involved with Parkinson's. So she's going to come in and speak. I'm looking at getting somebody from the boxing gym. I still need to contact them. I'm hoping they come out. They're over by the airport coming and talking about their Parkinson's program. And then at some point I'll fit in there to talk about swallowing and Parkinson's and speech and Parkinson's. So we're kind of lined up all through the fall now, end of the year.
Thanks for doing that.
Yeah.
John, do you mind if I ask where you heard we're still working on getting the word extra brand new? It's like this little snowball, right? Bigger. Where did you hear about the meeting, or where did you see it by chance?
I heard my brother goes to the Catholic Church. I think it's
St. Joseph? St.
my brother and myself work together,
Oh,
and so he showed me the article. That's
oh,
all I found.
wonderful.
So,
Yeah, I'm so glad they put it in there. Awesome, very good. We're trying to reach out to the churches too, in the area, but they have so many, groups that want to advertise, or not, we're not really advertising, we're just getting the word out. So that's good to know. We're gonna keep working on that, yeah. How did you hear about the group?
We're living in East Market, the senior citizens apartment. So every time there's flyers, it will be posted, so I was able to read it this morning because I was with the Zumba group.
Oh, there was a
Nice.
flyer here?
No.
Oh, I'm sorry.
So, so he told me we should go and try to listen and,
Oh, yeah. Are you talking about the senior citizen here on Pajaro, or, I'm
no,
sorry?
in East Market,
Oh,
the
okay.
Gloria apartment, we
Yeah.
stayed there.
So they had
They had the flyers that we got.
No, the flyer, I got it from the library at Main, North Main. The new library there.
they had it in the library.
Cool.
Yeah.
Oh.
I got
That's
it.
great, because we didn't put it there, but I think it's a great idea, we should, I think.
I did contact the library.
Yeah.
That's good, though.
It would be great ideas. In fact, if I can, if you wouldn't mind, if I could, send you, the next month, if you could post it. I have next month's flyer here. Where you live, that would be great, because it's just, this is a big community, but people just don't know what's available to them to help them on this journey. So, the support, the information, so, yeah. Yeah.
This is very appropriate for senior apartments
Yeah,
because
yeah. I thought you got it from there, but then, because I was
Yeah, definitely, yeah, it would be
here
great to,
this morning, so when
Yeah.
I came home, he told me that let's go and.
yeah, no, that would be great, I'm so glad this way, we'll chat at the end and maybe we can work something out that maybe you'd be okay with helping us out, posting something where you live.
Yeah.
That would be fantastic.
And we will be inviting some people because
Okay.
we have also some tenants who are having this Parkinson's.
Oh, yeah. I'm kind of playing with the time. Our first meeting in January, we had a bigger turnout, and people were saying, "Oh, 5 o'clock is great." I was thinking, "Oh, that's not great," because we had to kind of use the time that was available here at the hospital. But I'm kind of playing with the time of maybe like an earlier afternoon. What's your thoughts on this? Would this be easier? Because I'm thinking this is dinner time, and I'm kind of wondering if it'd be easier.
Well,
What do you think?
it's after work.
Yeah,
That
see,
works for
that,
me.
yes.
Works for me, but I don't know, it could be earlier, 5 maybe for someone else, but I'm only 5 minutes away from here. So I'll close at 4:30 and
Yeah.
I can make it, so it was scheduled.
Then that's perfect, then, yeah.
Later in the evening, so.
Yeah, and then if it gets too late, especially during the winter, it gets cold, people
Dark.
want to turn in, so maybe this is a good time then. We were kind of thinking that too with people who work. So, and that's great you're working.
Yes.
That's awesome. I love to hear all that you're doing to still live your life fully. I just love that. Yeah, so great to hear. Great, yeah, so, little by little, we'll get the word out, people tell other people. And then I guess we're gonna start maybe hopefully posting a few things at Balance.
Mhm.
And that's gonna be a big deal, I think, too, is people who actually go in for physical therapy for Parkinson's, they'll have the option. And CSMB is running, their student clinic here in town, that's in North Salinas. They're running a Parkinson's clinic there, and
Oh, cool.
they're gonna put some flyers out for us also next time.
That's awesome.
Yeah. Well, great. Well, then, I hope I see you all, next month. I do have a flyer here for next month, if you'd like to take one. Even though it's a caregiver, I think it's something maybe, I think the person with Parkinson's, would benefit from. And if anything, the person with Parkinson's, I think, could give the caregivers, advice. Does that make sense? Like, what do we need from the people around us? What do we need from our families? Do we need anything from our families? Do we just need understanding? That would be really nice to have. I do have a sign-up sheet, a sign-in, just because this way, if we cancel a meeting or, something weird happens, I can contact people. If you'd be open to signing, that would help. Parkinson's?
My name is John Chirazi, and, but I said before, maybe 2 or 3 years, maybe about a few years ago, I was diagnosed. And it was funny, I was going to have my ears checked. And the doctor is an ear and nose specialist, whatever he is, and he said, he noticed I was shaking a little bit, and he just out of left field said, you should get checked for Parkinson's. I had no idea. I always kind of thought it was a nervous twitch, And so I went to another doctor, a couple doctors, and they diagnosed me with Parkinson's. But it was really obvious to me because of the shaking, the uncontrollable shakings, that something was wrong. So, but what I hear, I'm kind of at the commencement part of it, like with your picture.
Oh, that's good.
Part of the beginning, so.
Kind of like in,
that, right
like in
there,
these.
And my understanding is that I'm already on medication. I guess you say Salinas, or Cinnamon.
That might be a,
That might
might
be
be a
one.
brand, yeah.
Yeah, it might be a brand name, I'm not
But
sure.
anyways, I take this medication every day, and I'm exercising, and I'm trying to have more understanding about it. I'm married, and I have a daughter. So it's kind of, I have a little bit interest in staying active, and as long as I can be. So,
Well, I think
That's
that's
awesome.
the great news, like what you've presented and we've had other speakers present, is there's a lot of living with Parkinson's. It's just learning to get to the therapies, to get to the programs, to help you live this full life. Parkinson's, and as you may know, Parkinson's isn't a death, thing where it doesn't kill you. What takes people's lives is the falls and then the pneumonia from the swallowing. Those are the two big ones. And so those are things that to a large extent can be well treated for a long time. So that's why I'm excited about this group, is so people can live their lives and don't think it's done. I have Parkinson's, that's why I'm so glad you're still working. But there's so much of life to still live, and live with good quality.
Yeah.
Good quality. So that's, and I'm so glad when you guys said you were gonna come, I was like, oh, this is great information to get out there also. Last month I spoke, and I did bring them, I apologize, I could always email them to you. I spoke on websites that I found that I thought were very useful with information on Parkinson's. And so if you're interested, I can email it to you, a list of it, of different places to get good information. One of my favorites, you may reach, that I really love, a lot of us love, is Michael J. Fox. It's amazing. He's done amazing work. I mean, his association. So, but I have maybe 7 or 8 sites there that give some really good information on Parkinson's, and some good videos that are. We have to be careful what we find online. Not everything is research-based, and some of it's snake and oil, whatever, oil and snake. I always get those terms wrong, so we have to be careful. But the ones I found are good ones based on evidence research.
And if I can add, as far as the Michael J. Fox Foundation goes, the first time I thought my dad had Parkinson's, I actually went onto the website and I looked, and they were having a seminar in Oakland that I literally drug him to. Because I don't have Parkinson's. It's like, we're going. And it was so informative.
That's good.
So if you go on their website, they also list like local seminars that they have, and they're really informative.
Yeah,
If you're interested in that.
they're excellent. I looked. I don't think there's one in the area for that's been listed. But I'm sorry, it's not coming to mind right now. Our group under Parkinson's Association Northern California, PANC, has big informational meetings too, and I don't have the date of the next one. But if you go on their website too, there's some good information. I have it listed on there too.
And I believe I think I brought paperwork back from them.
Yeah, that's all.
Because also they have,
Yeah.
I guess, different informative groups and booths and stuff where you can pick up information.
Yeah,
So, and I know that they are involved big time with that.
yes,
So
that's how I
That's a very
connected with
good
them.
resource.
Yeah. So I'm looking forward to maybe, we talked about reaching out to neurologists and getting the word out there that this group is here, but also getting education out there. And that's such an exciting thing, because we don't have that in this community. And there's no reason why we shouldn't, right? We deserve it. Salinas deserves it. Salinas Valley deserves the same level of care as you would get if you lived in a bigger city. So, so I'm looking forward to working with you. I'm excited about what this can help do for people's quality of life. And I'm very excited, and I so appreciate everybody being here today.
I am just so concerned because earlier he said he doing the treadmill. Is it advisable for him?
That is a treatment that people do. For Parkinson's, that's like, that is an activity, I should say, that people do.
I think the treadmill, it's controllable. So like if I could bring it, I could make it slow, but I have fallen one time. But it was I don't know if it was related to the Parkinson's. I got on the treadmill the wrong way. But, I can control the incline, and I'm in my house, and just through the garage door, somebody's there. So it's nice to have that.
I'm wondering if somebody should be checked out for balance maybe before.
Yeah, so that's
advisable.
And that's what I had said, like if you come to physical therapy, we're not just gonna be like, all right, you have Parkinson's, let's go straight to this treatment. We do a whole body approach. So we are looking at your strength, we're looking at your endurance, we're looking at your balance, we're looking at your range of motion. Because as Christina said, the rigidity can take an effect on, your joints. And all these are factors that play into movement. So we don't just look at we don't scope in on one thing. There may be some things that we look at more than others, or we focus on more than others from treatment session to treatment session, but we would never put you in a situation where you were unsafe before we assessed it. So if that was something that was a goal, you want to be able to walk on the treadmill, but maybe right now you don't feel confident doing it or safe doing it, we could work on things to build up to that goal. If there's always a goal, and we'll try our best to make sure, one, that is an attainable goal, and two, is that something that we can achieve together, working together to get you to be able to do. Because that's ultimately, we want the best for every one of our patients. But sometimes some goals are more realistic than others, given the staging of Parkinson's. So trying to make sure that we're realistic, but also giving you something to work towards.
So I'm thinking even in stage 5, you could help people. They're not going to be walking again necessarily, but like you said, big movements, thinking, large and buttoning their shirts and a lot of things that could still be done.
Independently, even with like transfers, helping out on caregiver burden. So helping things like that too, so that if you have a caregiver that's helping you, making sure that you can still help them as much as, and doing as much as you can, even though it wasn't what you could do before. Still doing like transfers, getting dressed, brushing your teeth, brushing your hair, things like that. Still, making sure you can be independent as possible, given, the stage of Parkinson's that you may be in. Feeding yourself's a big one too. Yeah.
Yes, I'm sorry, I'm not sure who's speaking to me though, which one. I have to look. Okay.
Marlies here.
Marlies, hi Marlies.
Yeah, my husband goes to, we just started about a little over a month ago, the Power Over Parkinson's by the airport.
Oh, yes.
And they have a bunch of programs. It's not as individualized as, what you were talking about there, but it is one-on-one. We're in where you need not real active. So it is
Marlise is speaking about, and we've talked a little bit about it in previous, and this is, I definitely want to give them a call to have them, hopefully have a speaker come out to talk to our group too. And I think a lot of this is having a, what do you call it, smorgasbord of things out there, having a cocktail that fits for a particular person of different therapies, etc. But Power Over Parkinson's is a gym over by Monterey Airport. And as Marlise was saying, you get a one-on-one coach, which is amazing. They're typically graduate students, or if not all, from CSUMB in kinesiology. And the whole, but I understand from what you were saying, Marlise, the spouses can work out too, a partner. You can.
You can.
Yeah. So spouses and.
They have like Tai Chi, which we've never tried, and yoga, and a few other different things like that. Tai Chi, yoga, dance classes, which we've never tried. We've been doing the strength and stretching and balance classes, and they have like levels 1, 2, and 3, more advanced, less advanced, to more advanced, and so there's a range on that one. And then again, I don't know what the Tai Chi or yoga, we haven't tried that in dance, but there's a website and it lists those different. And there's a coach for like the stretching class, but then the students from CSUMB, they will work, usually it's one-on-one person will help you with the things that the coach, I don't know for a better word, is telling you to do, and exercises to try.
Yeah, particularly if any of the dances is probably great. If the dance is like a pattern dance, like a line dance. For me, in my field, that I work with cognition, patterning and having to follow a pattern, repeating a pattern is good for the body. Really, really great for the brain. So I think all of this just sounds amazing. So there's so much out there, that can help. And I'm so glad that that's worked out for you, Marlise, and your husband. I'm excited to have that. My dream.
Right.
I dream big. You'll learn this about me, but I eventually get my dreams. That eventually happen. Down the line, 5-year plan. We get a foundation in the area, and we have our own boxing gym here in Salinas. That is a dream. I can't do it right now because I'm overwhelmed with my practice. But someday, you know that, I'm overwhelmed. But someday in the future, I'm hoping we can get a gym here too.
It's wonderful.
Yeah, we'll see. Yeah.
Awesome.
Well, great. Well, thank you, Marlise, for your input. I appreciate it. Oh, Mina.
Sure.
Okay, great. Once again, we're meeting next month. The flyer's right here. It's going to be May 29th towards the end. The speaker is Nancy Belton. Her husband lives with Parkinson's. And it's going to be, once again, the Parkinson's not only affects the individual, but the family as well. She's going to discuss her experience and insights so that caregivers will be able to provide the best support for themselves and for their loved ones. Okay? We have here some cards if you're interested in more information. And we have Abby's card and then my card if you, not that you have to take it. There's some great information. You already have it on your chair here to take with you. And then once again, if you're able to sign in, gives me a chance to stay in touch if you like. Yeah, that's it. Thank you so much for joining us. This was
Thank
great.
you.
Thank you, ladies.
No, of course. Thank you for your time.
What was that HY